Assalamu alaikum students. Today we will discuss uh, the second chapter of circulation, and the topic of discussion is vascular distensibility. So as the name indicates, vascular means vessels and distensibility means the dilation, the capacity in the vessel. So we will discuss in detail today the topic of vascular distensibility. When the pressure in the blood vessel is increased, this dilates the blood vessel and therefore decreases their resistance. So when there is increased blood pressure in the vessel, so the blood vessel dilates, its diameter is increased and it expands. So when its diameter is increased, there is more space inside the blood vessel and there is a little resistance. The resistance decreases and the space increases due to dilation of the blood vessel. And why blood vessel dilates? Because of the increased pressure, because the pressure is exerted outward. Pressure is exerted laterally on the walls of the blood vessel. So that's why the blood vessels dilate and the pressure, due to the pressure, and there is a decrease in resistance. The result is increased blood flow. When the resistance decreases, blood vessel is dilated. Due to increase in pressure, the blood flow is increased. But also not only because of increased pressure, but also because of decreased resistance. So both factors, increase in pressure and decrease in resistance, increases the blood flow, usually giving at least twice as much flow increase for each increase in pressure as one might expect. So what you are expecting, the blood flow is twice much increased as you are expecting. So the two factors that are increase in pressure and decreased resistance. The most distensible by far of all the vessels are the veins. Even a slight increase in venous pressure causes the veins to store 0.5 to 1 liter of extra blood. As I have studied, you have studied, and I have taught that the veins are the reservoirs. They can store the blood. Therefore, the veins provide a reservoir function for storing large quantity of extra blood that can be called into use whenever required elsewhere in the circulation. So the blood remains there until the requirement comes. When there is a requirement, the blood comes from that reservoir, that is the veins, and will be used. So this is very important function of veins, and this is because the veins are more distensible than arteries, almost 8 times more distensible. You will study in the next slides. And the fractional, this is the definition, the fractional increase in volume for each milliliter of mercury rise in pressure. So when the pressure increases, there is increase in volume. The volume correspondingly increase. Why? Because when the pressure increases, there is dilation of the vessels. There become more space in the vessels, and when there is more space, then the more blood comes to that more space, and so more volume is there. And the vascular distensibility is equal to increase in volume over increase in pressure into original volume. The two things that are increase in pressure and multiplied by original volume are on the lower side, are in the denominator, and while the increase in volume is on the upper side. So the increase in volume is divided by increase in pressure into original volume. So when the 1 millimeter, you can further clarify this numerical by the following example. When 1 millimeter of mercury pressure caused a vessel that originally contained 10 ml of blood to increase its volume by 1 ml. The distensibility would be 0.1, because you can see here the original volume is 10 and increase in volume is 1. You can see here increase its volume by 1 millimeter. So increase in volume is 1. So keep 1 on the upper side and 10 on the lower side, and increase in pressure, that is 1 millimeter of mercury, also on the lower side. So 1 over 1 into 10. So when you perform it mathematically, you will get 0.1. 1 over 1 into 10. Okay, so this is mathematics. So 1 over 10. This is 1 over 1 into 10 means 1 over 10. Because when 1 into 10, this is 10. So 1 over 10 is 0.1. Okay. When you write 1 over 10 in a decimal, you can write it as 0.1 per millimeter of mercury, or 10%. If you will write it in percent, then it is 10%, because in percent you have 100, you will multiply it with 100. So when 0.1 multiplied by 100, it comes to 10% per millimeter of mercury. So you can write it in both ways, either 0.1 per millimeter of mercury or 10% per millimeter of mercury. So these are the few facts regarding the distensibility of arteries and veins. Anatomically, the walls of the arteries are far stronger than those of the veins, as you have studied. The walls of arteries are more stronger. They contract more forcefully than veins. They have more collagen. Consequently, the arteries on average are about 8 times less distensible than the veins, because they are more stronger. So they are hardly to distend, hardly to dilate. So they have a little elasticity than that of the arteries. So veins have more elasticity, arteries have less elasticity. Okay. And veins are more distensible, veins are more elastic. Okay. Veins can dilate more than arteries, so clear it. That is a given increase in pressure causes about 8 times as much increase in blood in a vein as in artery of comparable size. So when the equal pressure is applied in the arteries and same pressure is applied in the veins, but the veins on the same time contain 8 times much blood than the arteries. The pulmonary veins' distensibility are similar to those of the systemic circulation, but the pulmonary arteries normally operate under pressure, about 1/6 of those in the systemic arterial system, and their distensibilities are correspondingly greater, about 6 times the distensibility of systemic arteries. So the pulmonary arteries are more operate under the pressure about 1/6 those in the systemic arterial system, and their distensibility is 6 times greater than the systemic arteries. So pulmonary arteries have more elasticity, have the more capability to dilate, 6 times more capability than systemic arteries. But pulmonary veins have same distensibility to systemic circulation. So there is a comparison between arteries and veins, and then there is a comparison between pulmonary circulation and systemic circulation. Okay, this is all about this lecture.